Through the day with some form of fatigue. But when does it become a real problem and what can you do about it? Joining me today to talk about the causes and treatments for fatigue is Peggy Demetrio from Qvita Health and Wellness. Peggy, welcome back to the show.
Thank you. I appreciate it.
So fatigue, Carly and I were kind of talking at the beginning of the show a little bit about how, yeah, we're definitely tired. Tired, fatigue, I think sometimes we use those words interchangeably. I'm wondering, is that the right thing to do?
Yes, not necessarily. I mean, we all get tired at some point, and it's usually from something you can identify. You were up too late, you were finishing a project, but once you resolve that problem, your fatigue or your tiredness gets better. Fatigue is when you've rested, you've tried to eliminate that issue, and you're still fatigued. You're still tired. So that's when it's not really just feeling tired, it's a symptom of a problem.
Interesting.
Yes.
And so symptoms of the problem, though, I'm assuming symptoms can kind of vary and maybe vary with age. And I know that's something we're going to take a closer look, right?
Absolutely. All the age groups have different reasons that dominate fatigue. And there is some overlap, but we find that from the younger to the older, there are different reasons when we rule out and when we do evaluations.
Well, let's go ahead and visit. I mean, you're saying fatigue you can see as early as teenage years.
Oh, absolutely. They're in college, they may be up late, but we find that the most common causes are really their lifestyle, their diet. They may be skipping meals, they may have a lot of saturated fat, salt, excessive caffeine, and exercise is often lacking in this age group. And then there's medical issues, possibly underactive thyroid.
And I would say I've heard of that before, the underactive thyroid with people who've been younger. Now,
Yes.
of course, that's a younger focus, but then the 30 and up, I mean, isn't that just kind of normal? Aren't we all fatigued or all tired? Should we not be?
Not necessarily, yeah, it's not a normal thing. Like, we can't just say it's normal to be tired because we hit 30 or 40. So there's usually an underlying cause for that too. So at this age, there's a lot of responsibilities. You're managing family, work, so you'll start seeing depression and anxiety up on that list as a cause of fatigue. And other things like sleep apnea, iron deficiency, even what we say circadian rhythm disorders. They may be doing shift work or traveling for work. So there's a lot of causes like that in this age group.
Okay, I'm glad we're kind of talking about maybe a little more medical conditions and maybe you need to talk with somebody as the older you get, even though a lot of it I just kind of blamed on parenting, but you're saying if it's more than that.
No, there's other causes, yes.
Well, finally, let's go ahead and look over 50. Again, you think that's automatically going to increase because of age, but the symptoms, they can differ.
Absolutely. This is the age group we start seeing hormonal changes. So women, it may be menopause, their estrogen is being lowered, and men, they may have a lower testosterone. So these cause fatigue symptoms. There's also medical conditions like heart disease. We know this is still the #1 cause of death in this country. Often an early symptom is fatigue. So that's why evaluation is needed. And then other things, again, that overlap, like we mentioned, mental health issues, sleep disturbances. Over age 70, there's about a 30% reduction in muscle mass. So then that can make a person just feel tired overall. So there's a lot of other issues that plague this age group.
So say we're maybe reading one of those and kind of identifying like maybe this is a problem. We can't just have the problem without talking about the solution. How can you help?
So something that we do when they come to our clinic is really, I need a really good history. What's going on? How long have you had this? And once I get all that information, I know how to best address it. It may involve evaluation with lab tests, diagnostic tests, involving specialists as needed, and then looking for the solutions. It may be education. Maybe there just needs to be an improvement in diet or increasing exercise or getting good sleep hygiene. Other times it's treating a problem. Maybe you have sleep apnea and you're not wearing a CPAP machine. And then we also incorporate alternative things, IV vitamin infusions. We have a supplement line as well that's all natural, that's certified, which is uncommon to have that. So we offer a lot of solutions that suit all kinds of needs.
You know, maybe someone at home sitting watching and they're like, okay, you know, this fatigue, they've hit the nail on the head when it comes to the definition of fatigue. When do they know that they need to give you a call or seek help?
Sure. Usually if you've done what you think by fixing the solution, you've gotten the rest you need, and you're still waking up tired. Usually after about a couple of weeks, it's time to get checked.
And again, just picking up the phone, giving a call to you, and treating every patient differently. Because I'm assuming in your practice, you do see a lot of the different causes like you've been able to give us.
Oh, absolutely. We see ages from 5 to over 100. So, and the causes vary tremendously. So it's just very individualized, very customized how we approach each person and really find out what's making them fatigued, and how can we solve it so they can get to their potential. Everyone has an optimal potential, and you can't get there if you're always tired.
Well, if you are interested in more information from Qvita Wellness and Health, be sure to give them a call. There's the website as well, and we appreciate you coming in. Thank you.